morning, everyone. Welcome. I am truly excited to be here presenting today and sharing with you all and getting to know everyone as well. So I hope that you are okay to engage with me and share with me as I share and engage with you all as well. I'm extremely excited to be able to present on empowering the next generation, navigating cleft care, appearance, and social challenges with resilience. So as was mentioned about myself, I am a bilingual pediatric psychologist at Texas Children's Hospital. So part of what you've heard in regards to Dr. Olier's team, I'm one of those team members. I've been part of this team for the past 8 years for both cleft lip and palate clinic as well as craniosynostosis clinic as well. We are very fortunate to have our multidisciplinary clinics there, and you're going to be meeting a lot of our team members throughout the day. I have specialized in early childhood and craniofacial conditions for the past 8 years. It's something that I'm very, very passionate about, not just with patient care, but also for education and teaching for our learners there at Texas Children's. With me today, I have a very special guest. I have Dr. Megan Cressy, who is one of our psychology fellows who has been joining me in one of these clinics at Texas Children's and has partnered with me today to create our slides, but as well as create a handout that you'll find at the main table where all the resources are. Great handout with list of books and other resources and websites to keep in mind as well that will also align with what I'm going to share with you all today. I'd love to hear a little bit from you all and kind of get to know you all so that I also can adapt and adjust my presentation to questions or challenges that you all might have. But I'd love to get just a show of hands of how many is this your first time attending Cleft Con? Okay, good. And how many of you all have children under the age of 6 that are cleft affected? Okay. What about the age of 8 to 12? Okay, awesome. And then what about 12 and up? A few, okay, welcome, thank you. Thank you for sharing that with me. So what we know and what we have learned in my experience with working with patients that are cleft affected is that there's so much that is impacted, not just the patient themselves, but also the family system, the peer network, the journey that is experienced with regard to just the medical diagnosis, the treatment planning, the treatment process. And I want to hear from you all in regards to just domains that you have whether encountered yourself or that you have seen that your child has encountered in regards to just concerns and challenges. What are some of those big areas that kind of come to mind when you're thinking about the cleft palate journey and challenges that can be faced?
I would say speech, getting speech services.
Absolutely.
Our area has awesome speech people and stuff like that, but none that are really specific to, I mean, they might have done a few classes in their speech, but that's been our biggest battle is speech
Right.
services.
Right. So I'm hearing kind of two pieces here. One, kind of the speech delays that can come along for our children, but also the services, right? Having that specialization for a speech pathologist that has that experience with cleft lip and palate. Absolutely. What are some others?
I think that also goes into like dental and orthodontics too, because I'm not just going to take this on to anybody who doesn't understand.
Absolutely. So that specialization, knowing that cleft care requires some orthodontic care as well. Absolutely. What else?
I think from like the social emotional aspect of it, and especially now with mental health.
Absolutely. So the mental health, kind of the social well-being, absolutely. What did you have? Oh, sorry. Right. All these important areas that are impacted. And you know, the list goes on beyond what I have listed here, but you know, I think other areas that I hear about quite frequently is feeding, right? For our newborns who aren't able to latch on for breastfeeding, and that worrying, that concern about the attachment between parent and child is a concern that I hear quite often about. That social appearance and the social inclusion and engagement and how it's impacted by a child that has cleft lip and palate. And also just the medical journey alone, right? frequent appointments, frequent surgeries, frequent visits to the orthodontist, frequent visits to the speech therapist. We know that all those pieces are huge concerns and challenges that our families encounter. Bullying and teasing is another that I hear quite often, and I'm always quite surprised to just hear it happening younger and younger and younger. I think in my time, it was always just, middle school was always the hardest because we had the mean girls, as they called it at that time, and now it's happening in elementary, it's happening in pre-K and in kindergarten, and really wanting to empower our children to be able to kind of be prepared for that, but as well as really standing up for that and being prepared for those pieces. Also thinking about the impact that it has on the family system. For those families who have multiple children and being able to then separate for multiple appointments, surgeries, that time away from each other impacts everyone. I come across many families who will share with me, but my oldest feels really left out because I constantly have to bring, Johnny to the medical appointments, or we have the NAM visits, which are quite frequent to be able to continue those services. So biggest pieces also that I know and I recognize is also self-esteem and confidence. And this, again, is happening younger and younger. Many of patients that I see here at Texas Children's will share with me about how they just don't feel that they are special or don't feel that they are normal. And that really impacts confidence in so many other domains, can lead to more low mood, can lead to more exclusion from not wanting to be included in social engagements or kind of avoiding social interactions as well. So just the whole plethora of challenges and concerns that I know that come along, and that I know that you all are here to get some tips and some tools about how to empower our next generation. With concerns and challenges, though, also comes resiliency. That's the most important part I want you to remember today, is that I know it's a challenge. I know that there's so many challenges that you will come across, but I always want you to remember that there is resiliency for your child, for your family, and there are ways to have that empowerment for your child. So I want to hear from you all. What are some ways or just pieces of your lived experiences that you would identify as strengths and resiliency for your child, for any child? Sure, sir.
The big thing was, my son's 31, and he was adopted when he was 3 with a cleft palate.
Mm-hmm.
And so he had to grow up with sort of the two stigmas, one being adopted,
Right.
two having cleft. Identifying, with, being adopted. There are times as they grow up adopted that they welcome the fact that they came from someplace else,
Mm-hmm.
and there are times when they try to hide where they came from.
Absolutely.
The one thing I always told them is that they're talking about, oh, you had this challenge, I had that challenge, bullying in school, surgeries, learning a language, all this stuff. And you overcame every one of them. So the theme in our home is always, you overcome. You overcome every challenge.
Mm-hmm. Mm-hmm. I love that message. That messaging is so empowering of taking the time to reflect and to listen and to hear, but also to acknowledge that overcoming.
And the second thing real quick is controlling the dialogue. When both my kids, my daughter developed type 1 diabetes when she was 8 years old, and she hated it when some other kid go, oh, well, Cindy can't have this because she has diabetes. It would upset her greatly and she'd get really
Absolutely.
mad. On the other hand, if she was able to say, oh, I can't have that because I have diabetes, that was within her empowerment and to control that dialogue.
Mm-hmm.
So I always talk both my kids, control the dialogue.
Yep.
Don't let somebody else control the dialogue.
Absolutely, and we're going to talk about that. Absolutely, that controlling that dialogue and preparing your child to be able to control that dialogue is really important. What are some other strengths and resiliency pieces that you recognize? So controlling the dialogue, listening, is what I gathered from what you shared, and also reminding them and sending the message of overcoming. Anything else that you all would add?
Sure. So I'm a medical social worker at Texas Children's, and I think Patty and I work closely together. Especially, I see this with our new families or prenatal visits, there's a lot of fear. There's a lot of fear of the unknown, especially because that journey is so fresh. And it's almost the infancy, right, of like the years that are coming in. So when families come to that first initial visit, towards the end, one of the last people who was able to go into the room, and they're more calm and they survive that visit, right? There's a lot of fear and a lot of maybe even expectations of what they're going to learn, what they're not going to learn. But at the end, when we go to process with families, and I see that they're like, okay, we got some answers. There's a lot more, right, that we're going to be asking, and I tell them, that's okay, that's good. Keep kind of asking those questions, but just take it as hard from this visit. And I see that they were resilient enough to show up,
Right.
to go to that visit, to just sit in that room, ask some questions, and I give them all that credit. I'm like, you did it. And I'm like, we're here to work with you. So
Right,
that's
absolutely.
a really big part.
Yeah. So taking that first step of showing up to the appointment, asking questions, knowing that you have a team there to support you. Sir, I know you had your hand raised.
I was just going to say empathy. We've noticed with our 12-year-old, it is just an amazing amount of empathy for all of everyone. And for me, it was odd. Like I wasn't used to that. And seeing him just practice that over and over again. And he reaches out to people. Like he'll walk up to us and go, "Are you guys okay?" I'm like, kind of looking at him weird, like, okay. Like, are you my kid? So.
Absolutely, that importance of that empathy. So just a few pieces to remind you all in regards to areas of strength and resiliency. That family support is key, right? I see that every day in clinic, and being able to work with a team and being able to know that we have a specialized team for cleft-affected patients and for children, and knowing that we also are knowledgeable of the therapies that are recommended and that are evidence-based interventions for a cleft-affected patient, but also recognizing what the child comes with, right? They gotta be brave, and they show bravery in so many different ways. And those are the areas that are showing whether they have an easy or difficult temperament, right? Those temperaments make a difference. I specialize in preschoolers, and oh boy, do I see those difficult temperaments all the time. But that temperament makes a difference, and sometimes it's the strong-willed kids that I'm like, yes, you're gonna go through this journey, and while you're gonna give me some tantrums and some outbursts, I also know and recognize that you've got that bravery, empowerment within you. Also peer interactions. I have kind of heard from some of my patients sharing that they connect and make friends and they have the support from peers. And while I know there's the other side of that as well for bullying and teasing, there are also the empathy from peers. And I think that is something that's so important for our children, especially when they're adolescents, to be able to have that connection, being able to have a peer who they can call their best friend and know that they can share about their emotions, about how they're feeling, or how a comment that was said hurt their feelings, or also the joyous moments of, my braces came off today, right? Like all those important journeys are really important. And also communication, right? The communication that they have with parents, that our child have with peers, with extended family, with teachers, with counselors, with therapists, all that is really important as well. So my role today here is to share with you, and again, I'm gonna welcome you all to share with me as well. These are just some guidelines and practices that I share with our families at Texas Children's, but really thinking about the impact of emotional, mental, and social well-being. These are the areas that, I hear about all the time and have to be acknowledged, that it's an important piece. And I want to be able to give tools thinking about all the age ranges and across the lifespan, because it looks different at every age. And if I don't get to all the pieces, we're going to have some time for questions and answers, but also I will be here throughout the day. So please feel free to stop me, pause me, and kind of just introduce yourself, and I'm happy to chat as well. So one of the main pieces that I always like to start off, and I think that this is the one sometimes that we can easily overlook, are those medical appointments. You've already found somebody, you've called, you've made the appointment. Maybe this is, the first time that you're meeting a team, or this is the time that you're going to be talking about surgery planning, or this is the time you're going to meet with the orthodontist to talk about braces. These appointments are really important, and we recognize that as a medical team. And the one piece that I encourage you all, no matter what type of appointment it is that make a list of questions. I love when I walk in and the parent pulls out from their bag the list of questions that they have, because you might meet many team members. Here at TCH, we have, I think there's like 8 or 9 of us that come in and meet every family. But those questions are important, because even if you ask the psychologist, me, a question about insurance, well, guess what? My buddy Jocelyn is right outside, and I'm going to have her come in. Or you ask me a question about the braces, you know what? I've got it. Dr. Worthland's going to come right in as well. So those questions are important. I encourage you to prepare those questions, especially if this is your first appointment, where there's no wrong question. This is a time for you to learn. This is a time for you to gather more information. Rather than Googling, I always encourage, don't Google. You're going to hear and read so much more that goes above and beyond what your child might need. Once you have those responses from your medical team, take those notes, right? You might be driving home and realize, oh gosh, I forgot to ask this. You know what? Call, send a message. Say that communication, because once you go to Google, you've already gone away from your child's treatment plan. I also want to encourage you to ask for explanations. Don't just nod the head and okay. No, why? Why is this recommended? How is this best practice, right? I want to make sure that you are leaving confident from that appointment with all the information you need, and even asking, so who do I contact if there are more questions that come up? I know some institutions don't have a team like we do here, and that's okay, but the importance is you knowing who your contact is and who's going to be responding to those questions that you might have. Also be important to make space for your own emotions during these appointments. I know many times for prenatal visits and initial visits, it's a space for me to come in and kind of just hear how the appointment is going, how are you feeling, recognizing that you just heard the long journey that is ahead, hearing about support, hearing about challenges and barriers, so that again, as a team, we are the support system for the family as well. And more importantly for parents, self-care. You've got to take care of yourself. I know a lot of things, lots of appointments, if you have multiple children, lots of extracurricular activities that come along as well. There always needs to be time, even if it's those 15 minutes that you can just enjoy, take a walk, have a bath, bubble bath, whatever you can do to take care of yourself is really important. The one piece that I always get asked is, how do I include my child into these appointments? Obviously, if they're a baby, they're meant to be sleeping in their stroller and being comfortable. If they're awake, then us as a team, we love to interact with them and just see the giggles and get to see them moving their arms and their legs. But as your child gets older, typically I say around age 8, there should be some inclusion of their decisions, their expressions as well. And I always find it fun when I have a child who's coming for a pre-op appointment, knowing that they're going to be on a liquid diet for some time. And they just learned that, and it's like, whoa, I don't want that. But that's the opportunity. So let's make the menu. Let's think what we're going to blend up. You're going to have as many smoothies as you want, and mom's not going to say anything about it. So making that menu, making the list of what you like. I see a smile over there. Is that what happened with some liquid diets? What was that?
Don't blend a hamburger.
FYI, don't blend the hamburger. Yeah, might also be thinking about admission if they're knowing that they're going to have to stay overnight, thinking about things that they want to bring to the hospital, what's already available in the room. We've got some hospitals that have really cool Xbox and PlayStations. Maybe they want to bring their own video games. But also providing a space for your child to ask questions. Being able to give them their voice to ask that as well. And if possible, getting connected with families that are part of that clinic, part of that team already. And that's the unique part of Cleft Con today. I'm excited that you all are getting to meet one another and that you're getting to hear each other's experiences. I want to highlight the social piece. I found this, this depiction that I think is really important for us to think about. You know, we get different reactions from people, whether we're cleft affected or not. But cleft affected patients get more responses, more questions, more stares from others. And responses are different from everyone. I have seen resiliency where a child would kind of just look and keep on walking. I've seen others where they'll hide and withdraw. I've seen others who show that anxious expression. And it's really important as parents to recognize that you might see the shyness because your child's feeling self-conscious. You might see them retreat or pull away and hide if they're feeling rejected. You might see that they might ignore others because they're feeling embarrassed, or that they might act defensively to protect themselves because they're feeling different. And I think tying the action back to how they're feeling is the first step, right? That's the first step. And many times I think everyone wants to jump to, let's just talk about it. But you as a parent also have to have time to reflect of how that's making you feel to see your child respond that way. Because guess what? You're the models. You are the models of how you're talking about cleft lip and palate. You're the model of how you're answering questions that others have. You're the model of how you are being resilient and how you are being brave for these areas as well. They are looking to you. So I encourage you to recognize those emotions, and it doesn't have to be in the moment, right? Maybe it happened at HEB, and now you're driving home, and it might be the conversation with your school-age child of, hey, Johnny, I noticed that back at HEB, it seemed like you felt defensive. Give Johnny the space to talk about it. Don't push. I think that's always the piece that parents want to push, 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 push. And sometimes, as parents, we're more anxious than our child is. And that anxiety that we're modeling because we're asking questions over and over is actually then giving the message of, to your child, wait a minute, I should be anxious. Or I should be afraid. I should be embarrassed. I should be defensive. And that's not the message you're wanting to send. You're sending the message, I'm supportive and I'm here to listen. You have to say that out loud. Because otherwise your questions are going to come off really implying that they should be feeling a certain way. I always encourage patients to have a plan. And this is something that as a family, you also as a parent need to make this decision, because again, you're modeling. Are you just going to walk away when there's a question? Are you going to have a script, which is what you mentioned, sir? And for either of those, I want you to praise and recognize and let them know, you know what, you did an awesome job back there just sharing that your scar was from surgery. Or you know what, you did an awesome job sharing about cleft. I didn't know you knew that much. Anything that they are demonstrating that they are being resilient, whether it's the walking away, they're having their script, those are important pieces to really recognize and praise. Social scripts are really empowering. They're giving them, empowering their voice. So exactly as this gentleman mentioned, no matter what they're empowering their voice for, this is an important piece, and this is an important discussion to have and to reflect and think about. I see some newborn babies here. You as a parent also have to think about, what's your script? What are you comfortable to say? I sometimes will hear patients even tell me, I hear the parents, you know, I think they're getting teased, I think they're getting bullied. And then I've had a 40-year-old turn around and tell mom, I'm not getting teased or bullied. I just tell them, I was born with the cleft, and that's my scar. And then they go on drawing. And I look at the mom like, that is resilience right there. That is resilience. And I'm so glad that so many are empowered and have that script already, but I know that there are others that need some guidance for that. So making sure that you're having those discussions and that you're providing the decision of whether do you want to share or you don't want to share. That's their decision. I know another area is appearance. And this is probably more common for my 8-year-old and up. And this is, again, where modeling becomes really important. So I always get the question at the first visit for a newborn, I shouldn't take baby pictures, right? You should. This is modeling. Those baby pictures are memories that you then are going to get to reflect on their journey and show them their resiliency, show them their bravery. First day they get braces, that's a wonderful picture. They might be upset and in pain, but that's a wonderful picture to take. You know, babies getting their NAM, absolutely take those pictures. Share. That is showing you as a proud parent and letting them see and know that you are 100% behind them. Talking about uniqueness in a positive way. So I like to use the word unique, not different. I think everyone is unique for very different reasons. The diversity, the pieces that just make us who we are the unique aspects. And being able to highlight about the whole person rather than just their lip and their face is going to be important as well. Thinking about the words that you're using to describe others is going to be really important as well. And again, as I mentioned, focusing on the whole person, focusing on their personality, focusing on the strong-willed characteristics, focusing on their hobbies, everything about the person is important to talk about in regards to, instead of just appearance alone. When we're talking about a uniqueness, one area that I know is difficult to kind of find a space to talk about with not having the intention of feeling disrespectful towards your child are books. Books are a really nice way to set a stage to be able to read a book that's focused on uniqueness, read a book that's focused on going to the hospital, reading a book that's focused on going to the medical appointments or surgeries. I guarantee you that one of the books, I think I always talk about the Bernstein Bears are going to the hospital. And patients will start to say like, oh yeah, look at the hospital bed. Oh yeah, we're going to see that in 2 weeks. What do you want to bring to the hospital bed? But it's initiated by the child. And that's the uniqueness of books. It's going to allow for that imagination and the questions to come up, for the uniqueness areas to also be highlighted for them. And it's most importantly a time for them to reflect along with you and a time for them to ask questions. There are books for everything related to hospital visits, surgeries. There's some great resources for teasing and bullying. The handout that Dr. Cressy made that's, again, available out there in the resource table has a list of books for different age ranges, some for teenagers and some for parents that I think are just great resources to be able to have as well. So kind of in summary, again, what I'm hoping that you're taking away today is that your child is resilient and that there will be more speed bumps along the way, more challenges to encounter. But again, the child and the family is resilient, and you all have those pieces in you being present today here. I hope that you get connected with other families that you can learn from, that you can share with, that you can reflect with. And always remember to model for your child. What you're saying, what you're doing, your facial expressions, all those pieces matter. And more importantly, keep advocating for your child. I was so glad to hear you didn't give up. You kept every avenue to be able to get connected, and everything fell into place once you were connected with the right team. But it took that advocacy in order to get there. So I really commend you, and I commend all of you, because I know that the journey is hard. I know that the journey is not easy. It's time-consuming. It's stressful. It's worrisome. And you all are doing a fantastic job, and that you are here and wanting to connect with others. Please use this space to be able to connect and to support one another. Thank you so much.